Good afternoon, everyone. Thank you all again for joining us as you all get settled to join us for our training. Today, wanted to introduce myself. My name is Dr. Karan Phillips. I'm a policy development manager here at TFAH. So we're going to start today with a little bit of context setting, and then we will get started with our presenters that we're excited to have today. So for those of you that may be new to our training sessions, we are Trust for America's Health. We are an independent, nonpartisan public health and prevention focused nonprofit based in Washington, D.C. We are deeply committed to making disease prevention a national priority. We are committed to improving the health of everyone in every community. And we focus on evidence-based policy and advocacy with a key focus on equity. TFAH is known for producing several reports annually. Some of you may be familiar with some of these, ready or not, Pain in the Nation. And this particular training is brought to you by the Age-Friendly Public Health Systems Initiative, which the John A. Harper Foundation is our great funder. And we also produce reports as well. We have one on housing, and we just released one. I'll make sure that gets in the chat momentarily on rural healthy aging. So again, as you all come in and get settled, we want to make sure that you keep yourselves on mute during the actual presentations. If you have questions, feel free to put them in the chat. We will have a time at the end of our training where you can engage with our speakers and come off mute on your own. But during this training, we just ask that you stay on mute, and we'll catalog and make sure that our presenters are aware of the questions that you all have for them. And with that, I'm going to, one more thing, my apologies. We do have closed captioning available for this training. So if you would like that, you can enable that at this time. And with that, I will turn things over to my colleague, Megan Wolf.
Thank you, Karan. Good afternoon, everyone. You could go to the next slide, if you would, please. So this year, our monthly trainings have been focused on our 6 C's framework for supporting healthy aging, which is the outline or as we like to describe it, the roles for public health. It is somewhat flexible, not prescriptive, but can help guide a state, local, tribal, or territorial health department in becoming an age-friendly public health system. And so today's session is focused on creating and leading policy systems and environmental changes. And I just wanted to note that as we are talking about this particular tenet of the 6 C's framework, this was the most recent C that we added. The creating and leading tenet was not part of our original framework, which was a 5 C's framework. After we had engaged in this work for a number of years, we realized that leadership is a very important, very valuable component of this work. And you're going to hear from some leaders in the field today who have been engaged in this work. So we wanted to make sure that we incorporated the component of leadership as part of this framework and advancing equity, as well as moving forward with age-friendly policies and programs. So next slide, Karan. So the change to becoming an age-friendly public health system does not happen in a vacuum. It needs leadership, but it's also not rocket science. So yeah, and again, you're going to hear some really great examples of leadership at a local health department from our friend Ryan in Walton County, Florida, in just a little bit. But there are many levers for change that as a leader you can take advantage of. You can look at data, including using census data to assess a community's level of support for older adults and caregivers. You can look at your neighborhood or your community, your jurisdiction, and think about what would benefit everyone, not just older adults, but to make parks and recreations and your built environment more age-friendly and inclusive for everyone. And you can certainly look at your state or community health improvement process, the assessment, and then the planning and prioritization of issues to make sure that there is an incorporation of older adult health and caregivers as well, to make sure that caregiver needs are taken care of. So these are just a couple of ideas that we have had. I just wanted to kind of lay that that groundwork, that framework for creating and leading change. Today, the topic of creating and leading is going to focus on assessments and how you can use the assessment and planning process to create and lead that change for an age-friendly public health system. So Karan, if you go to the next slide, and we'll introduce you to our speakers today, Anna Clayton from our wonderful partners at the National Association of County and City Health Officials, or affectionately known as NACCHO, not Nacho, but NACCHO. And I just want to recognize Abby Oliva also, who is one of the newest members of the NACCHO team. Welcome, Anna and Abby. And then we'll hear from Ryan Mims from the Florida Department of Health in Walton County, Florida, which is in the panhandle of Florida. You'll hear a little bit more about that. And Ryan has been an amazing leader. He's been engaged in this work since 2018, when we started the Florida pilot, and has just done some amazing work, very inspirational work in Florida. So we are going to turn first to Anna to provide us some information and background on the community health assessment, community health improvement process, and some new resources to share as well. Anna.
Awesome. Thank you so much, Megan and Karan. And I'll go ahead and share my slides. All right, you can see that colorful map slide. Perfect. Thank you. So good afternoon, everyone. My name is Anna Clayton, and I'm a senior program analyst with the National Association of County and City Health Officials. So we're very grateful to have been invited to this session to share about the newly released Mobilizing for Action Through Planning and Partnerships, or MAPP 2.0 framework, and a new tool from TFAH and NACCHO to explore healthy aging through a community health improvement process. So if you're not familiar with NACCHO, NACCHO is the membership organization for the nation's nearly 3,000 local health departments. We're located in Washington, D.C., and our mission is to improve the health of communities by strengthening and advocating for local health departments. So we provide technical assistance, training, funding, and resources to local health departments and their community partners. So I'd love to start with, this can be a chat question, but would love to know from anyone who has, how have you engaged with a community health improvement process or MAPP process in the past? I'm sure for some of you, there might be a lot that you could say about that, but if you'd just like to share a little bit about whether you have led a portion of it or participated on a steering committee, or please share if it is brand new to you, and that's great too.
Looks like we have some shy folks on the line today. Oh, thank you, Courtney.
Okay.
There's a few folks signing in now. There we go.
Thank you. All right, analyze data to prioritize goals. Part of the County Health Planning Council that had some input. Awesome. Thank you guys for sharing. Okay, well, it is helpful to know a little bit of the spread in the group of some have used MAPP, or you might be involved in different ways. So I'll be sure to provide information about both community health improvement and MAPP. So beginning then with a basic introduction to MAPP. MAPP stands for Mobilizing for Action Through Planning and Partnerships, and it's NACCHO's flagship framework for community health improvement. It outlines a community-driven strategic planning process to improve public health and advance health equity. MAPP helps communities prioritize public health issues, identify resources to address them, and take action through that shared health community health improvement plan. Typically, MAPP is facilitated by community health leaders, like the local health department, although it could be facilitated by others. And it provides a structure for communities to involve that broader local public health system and non-traditional community partners. So I'll be sharing about MAPP 2.0 today, which was just released this July. We launched it at our national conference, NACCHO 360 in Denver. MAPP was originally developed in 2001, and since 2018, NACCHO has been updating it. So this slide describes the key differences between MAPP 1.0 and MAPP 2.0. These changes were based on recommendations from a national evaluation in 2018. And they were also based on feedback from the field that we gathered throughout, and all of the new materials have been reviewed by or pilot tested by health departments. So in MAPP 2.0, you can expect to follow a similar process to MAPP 1.0 with more guidance and much greater focus on community engagement and identifying and addressing inequities. So this is kind of your side-by-side comparison for kind of a quick summary of what the major differences are between 1.0 and 2.0. MAPP 1.0 had 6 phases, which have been streamlined into 3. We had 4 assessments in MAPP 1.0, and now we have 3 assessments in MAPP 2.0, which I'll describe in a little bit. A key point here is that the goal of MAPP 1.0 was to improve population health. And there were supplements added over the years to help communities better address health equity as part of that process. But now the goal of MAPP 2.0 is to achieve health equity. So that being said, the new supplement for MAPP 2.0, it's no longer that health equity is your advanced version of MAPP, right? That is the core goal of MAPP 2.0. The new supplement is called the Power Primer Supplement. And that helps communities take a deeper dive into addressing inequities that are based in power imbalances, which can be helpful as part of their overall MAPP process or how they address or approach the CHIP process, for example. But that's our new supplement that I'll describe a little bit later too. So one tool to support centering of health equity in MAPP 2.0 is this health equity spectrum. This is also relevant to the new resource from TFAH and NACCHO, which I'll describe in a bit. But it was created to outline the relationship between root causes, social determinants of health, and health outcomes and behaviors. Much of our work in public health is focused on addressing the social determinants of health, the places that people live, learn, work, play, and worship, and thinking about how those impact health. But in MAPP 2.0, it's emphasized that while it's critical to address the social determinants, we must also assess and address root causes, those drivers of differences in the social determinants of health. So it's important to discuss what those systems are and aim to find ways to measure them in your CHI process so that they can be named and addressed. MAPP 2.0 also categorizes indicators for an assessment across the spectrum and encourages communities to take action on the social determinants as well as root causes as part of their CHIP. So going into some overview of MAPP 2.0. As mentioned, MAPP 2.0 is a 3-phase process. It's shown as a cycle because it's intended to be repeated and continuous. So for example, although data is collected in phase 2, you might continually update your data, or community health improvement cycles are commonly repeated on 3-year cycles if you're working with a nonprofit hospital, or 5-year cycles to meet accreditation standards. But overall, the phases are phase 1, build the community health improvement foundation, which involves partner engagement and preparation for the rest of the cycle. Phase 2, tell the community story, in which the community health assessment is conducted using 3 assessment tools. And phase 3, continuously improve the community, during which the CHIP is developed and implemented. So I'll just be going over some basics kind of each phase today, but I do want to note that we have lots of resources on our website, as well as the full handbook and guidance on our website for that deeper dive. But starting with phase 1, this phase really sets the stage for the rest of the MAPP process. The overall goal of the first phase is to engage a diverse group of partners and community members in establishing a community vision and planning for the rest of the process. MAPP engages the entire community. So as you're engaging partner organizations, you want to think about who makes up that entire local public health system beyond public health and healthcare. You also want to consider who else has an idea of what the community needs are, provides services, or advocates on behalf of community members. The process of developing the community vision is also a community-wide effort. And that's really important to establish early because it's like the North Star of your MAPP or CHI process. Your assessments tell you how far away you are now from that vision. So you want to establish that early as the goal that you're ultimately working toward over the next 5, 10, or 20 years. There are other key steps in this phase to help you prepare for the cycle by assessing what resources you have available and setting goals for how MAPP is implemented, like how often you engage the community and how meaningfully they're engaged and how you engage partners. One of the key steps in phase one that I just wanted to highlight is the stakeholder and power analysis. The purpose of this is to identify and assess the power, interest, influence, and importance of all the different kinds of people who could be impacted by the MAPP process or who could have an impact on the MAPP process. That helps you start off MAPP with a really broad view of who's in the community and who will be impacted by MAPP. It's a great way to identify new partner organizations to engage because you end up conducting some interviews with key stakeholders and analyzing them across those different domains of power, interest, and influence. So that can be a really helpful step to establishing that broad list of partners early on. So would love just to see some examples in the chat, and I'll continue going through, but would be helpful and great to have these. What kinds of organizations, groups, or partners would you want to bring to the table in order to assess and address healthy aging in your community? Great. Parks and Recreation, those AAAs. Employers. Right, so we're already thinking right outside of just public health and healthcare, but all these different services and who serves older adults and who has an impact on our ability to age in health. Great, thank you all for those additions. So imagine now that you've completed phase one and you have all these different types of partners at the table. Phase two is tell the community story, and that's when you conduct the community health assessment. The goal is to engage the community in developing a comprehensive and timely community health assessment or community health needs assessment, and to identify the top population health priorities and health inequities in the community, including their root causes. So these are the three assessment tools in MAPP 2.0. There's a mix of quantitative and qualitative methods, and the partner assessment uses a mix of those to understand how the local public health system is operating. We do have full-length 90-minute webinars about each of these on our website, which you can access for free. So I'll send that a little bit later, but I'll just do a quick touch on each of the assessments. So the community partner assessment looks at the local public health system and network of partners. If you're familiar with MAPP 1.0, when we had the local public health systems assessment as part of MAPP, that has now been replaced with this new community partner assessment tool. So through this, it helps the community understand each organization's work and capacity through a survey and to assess how well you work together as a network to address health inequities. So you're looking to understand who serves the community and how you can advance health equity together using those mixed methods. The community status assessment is our quantitative assessment. This assessment looks at health behaviors and outcomes, social determinants of health, and systems of power, privilege, and oppression using quantitative data. Across all of those, you would disaggregate your data to identify inequities. As you can see, this follows that health equity action spectrum described earlier. So for this, you would use methods like gathering and analyzing secondary data from your health department or health system or other partners, or gathering new primary data, perhaps through a survey. Lastly is the community context assessment. And this is a qualitative assessment that looks at three domains. First is strengths and assets in the community, in the people in your community, how the built environment contributes to health. So thinking about Parks and Rec as a partner, that's exactly what we're looking at is, how the places that we live and work and our communities that we live in, how the built environment of those contributes to or impacts health. And lastly, our current or historical forces of change, which are things happening now or in the past or that may happen in the future that can impact health. Methods for this would be things like focus groups, specifically looking at subpopulations who are disproportionately impacted by inequities, key informant interviews, and asset mapping. So it's not intended to explore specific health issues, but rather to understand community perspectives on living in the community, what's going well, what can be improved, and how those things contribute to health. Lastly is phase 3, continuously improve the community. This phase involves steps related to the community health improvement plan, including prioritizing what issues go into the CHIP, establishing which partners will implement the different activities, and implementing and evaluating the CHIP. So this overall brings the MAPP 2.0 process to a close with phase 3. And as you mentioned earlier, as I mentioned earlier, it's likely to be repeated every 3 to 5 years and has those continuous components like adding new partners throughout the process or updating data as it becomes available. I just briefly want to note this new supplement that I mentioned earlier called the Power Primer. It's a process for communities who want to address power dynamics within MAPP, understand societal power imbalances as a root cause of health inequities through their process. It's like the advanced level for addressing health equity in MAPP, and it's intended for communities who are ready to take that next step. So again, there's a full 90-minute webinar overview describing the Power Primer on our website that I will share with you, but just wanted to make sure you all knew that that was an additional resource available. So switching gears a little bit from my overview of MAPP 2.0 into this new resource that has been recently released by TFAH and NACCHO. So this resource is going to describe how communities can leverage community health improvement processes to make progress on healthy aging work in their community. So based on what we've reviewed so far, there's lots of great opportunities to use a community health improvement process as a way to understand the status of healthy aging in your community and to make improvements to advance healthy aging. First and foremost, these opportunities include developing those partnerships with healthy aging organizations that you named, like AAAs, the Housing Authority, healthcare organizations. And then they would be part of that conversation about what can be done to improve health, including working on healthy aging priorities. Similarly, as you're engaging the community, you can use community health improvement as an opportunity to engage older adults in the conversation about community health improvement and how that work can support people to age in health. One of the most important ways to leverage the CHI process to address healthy aging is to collect, analyze, and translate relevant and robust data. So think of those 3 assessments. If data is already being gathered about the community, there's an opportunity to include measures in there to understand indicators related to healthy aging and use that data to understand what's needed to improve health. Additionally, that data can be shared with the community. So thinking about leveraging these different opportunities. Lastly, the purpose of a community health improvement process is to make that policy, systems, and environmental change. And that's done through the actions of the CHIP. And the opportunity here is to consider how those PSE changes contribute to advancing healthy aging and ensure that the interventions and the data that led to them are informed by your key stakeholders. So this new resource is called Indicators of Healthy Aging, a guide to explore healthy aging data through community health improvement. It was developed to outline how you can address healthy aging through CHI with a specific focus on the community health assessment. So it provides recommended indicators, measures, and secondary data sources to understand healthy aging. This guide includes a broad list of indicators and measures that can be used in that assessment. And they were gathered based on a comprehensive review of the literature, data sources, and input from subject matter experts on both healthy aging and community health assessments. So the indicators that were selected meet these criteria on the left, and they're all priority population level indicators and benchmarks associated with domains of healthy aging. They're broken down into current indicators, which reflect local data, and prospective indicators, which meet various levels of data availability, but may not have as much of that reliable baseline, but they might be more emerging issues explored through research, and they're going to be available at the state, regional, or national level. So I told you this would come back, this health equity spectrum. The recommended indicators in this guide are, well, the guide is aligned to MAPP 2.0. So the indicators are organized into these 3 categories. So root causes, which are called systems of power, privilege, and oppression in MAPP 2.0, social determinants, and health behaviors and outcomes. And it's recommended to gather data across the spectrum. So I'll just provide a couple of examples, and there's much more to explore in this guide overall, but to give you an idea, these kinds of system level indicators would be important to understanding the root causes driving inequities that impact population health and well-being across the life course. There's currently limited data and research available to comprehensively explore these as they relate to healthy aging across the life course, but the recommended indicators should help communities identify factors contributing to inequities. The social determinants of health indicators are grouped along the domains of Healthy People 2030, so economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. And they would help you understand healthy aging in the diverse contexts in which older adults live. And lastly, the indicators within the health behaviors and health outcomes category reflect the physical and mental well-being of older adults within a community, such as length and quality of life, prevalence of diseases or conditions, mental and behavioral health status, and more. And additionally, they include indicators to monitor behaviors and outcomes that negatively influence health and well-being. So I just pulled a very short list for each of these categories. Again, there's much more to explore between the current and prospective indicators in the guide. And additionally, you will find in there these additional considerations, as well as more considerations for addressing healthy aging through CHI. So just a few things to note. First, as you're using this, be aware that there are going to be limitations to accessing local level data, and much population level data about social determinants and systems are not as available at the local level, especially not disaggregated by age, race, and ethnicity. So there might be that need to conduct additional primary data, of course. Additionally, it's critical to consider how you can disaggregate the data and compare subgroups and identify differences in the burden of disease or opportunities for health. And lastly, considering this concept of intersectionality and that risk and protective factors occur in multiple contexts and shift as we age. So this concept acknowledges that individual life changes are shaped by multiple overlapping systems of oppression, such as racism, sexism, and classism. So it's important to not consider any one factor completely alone. So I just want to note that this resource is available via the link that Karan just sent, and you can download all of MAPP 2.0 and access our virtual community at nacho.org/MAPP. And this is my email address if you have any follow-up questions, but I will be on the call for any questions that arise later. And I'll hand it back to Megan.
Thank you, Anna, so much. So much wonderful information. Really appreciate you sharing the new indicators of healthy aging guide as well. I'm looking forward to digging into. I think I really want to look at that power primer. I think that'll be really very, very helpful for a lot of aspects of our work. So thank you so much. There we go. So Karan will bring up Ryan's slides at this point, and we will turn now to Ryan Mims from Walton County to hear more about how Ryan has been using how he's been creating and leading change as well in his community. So Ryan.
Thank you, Megan. I see some familiar names, so that's exciting for me in the attendance. So that's fantastic. My name is Ryan Mims. I am the Chief Health Strategist with the Florida Department of Health in Walton County. These are some of the people I get to work with every day, and some of our public health heroes here locally in Walton County. So I always like to show them off. And Holly Holt is our health officer and administrator. She is really passionate about making sure our community is as welcoming and as safe and as healthy as possible, and including everybody across the age span, regardless of disability status, economic status, all of that. So she's really the leader that I get to work under and kind of represent as much as possible. And Holly's been great. So go to the next slide. A little bit about Walton County. We are in the panhandle of Florida. So some people refer to that as South Alabama, but we are proud Floridians in the panhandle. Walton County is halfway in between Tallahassee and Pensacola. We have some of the most beautiful beaches in the world. Definitely the most beautiful beaches in Florida. So we are very proud. We're a vacation destination. Some people might recognize 30A, might see stickers on back of cars and stuff like that. That is part of our county, the coastal part of our county. Our county is pretty big. It spans all the way from the coast all the way up to the Alabama border. We are about 83,304 population as an estimate from the U.S. Census. That is growing. We are one of the fastest growing counties in the United States. So that's something that we have to keep as our both a opportunity and a threat if we're not planning correctly. And a large percentage of that is an older adult population, definitely 50 and older. So that's something a trend that we keep an eye on to make sure that we are thinking of everybody when we're planning some of our activities. So our population changed since the last census. We've increased 10%. So like I said, we're pretty fast growing. Before we know it, within the next, I think it's estimated within the next 15 years, we'll get to 100,000, and then we'll just keep on growing since then. Our percent of population above the age of 65 is about 1 in 5, 20.5%. That statewide percentage is actually wrong. That would be a large chunk of it being above 65. Is actually 21.6%. I had a percentage of 60 and older, and I think that's why, or 55 and older. So and I didn't change that statewide note in the bottom. So that should read 21.6. So we're a little bit less than the statewide percentage, but like I said, that percentage is growing year to year. And as I said, we was a destination for vacationers and tourists. Our population rose exponentially during summer season and also winter season for seasonal residents. But we last year we had a estimated 5.3 million visitors to our county. So at any given time, 83,000 could be 150,000. And also we have a lot of snowbirds that come down, have partial residence in our county for a couple of months in the winter. So very important to keep in mind that our county is kind of growing. We have very dense kind of infrastructure and in the south end of our county, and the north end of our county is more rural, more spread out, and more farmland. So next slide. Like Megan said, we've been part of kind of the age-friendly trend for public health since 2018. We had a statewide meeting that we attended, each county attended in Orlando in October of 2018. This has been something that our health officer has been kind of wanting to work more towards. So we kind of jumped in on the age-friendly trend pretty early and kind of incorporated it into our practices. In 2019, in May of 2019, we officially joined the AARP network of age-friendly states and communities. And so we kind of worked with our county commissioners, with our Council on Aging and the Department of Elder Affairs with Florida, and working through making sure that we are coordinating age-friendly activities. And we became an age-friendly public health system as received that recognition in August 2022. A little bit slow on that. There was a pandemic that happened that kind of slowed that down. But I'll also talk about the importance of having an age-friendly lens and having that kind of momentum that really helped us during the pandemic to have those relationships and those partnerships already formed, and making sure that we are thinking of older adults. And the pandemic is a great example of how having an age-friendly mindset really helped secure and have a foundation to build off of. Next slide. So in public health and definitely in a local public health system, alignment is the best asset and the best technique to make sure that everything we do we're wisely using our resources correctly. So the Department of Health in Florida, and we've used MAPP, the original MAPP framework, which most all counties pretty much in Florida use. So the Department of Health at the county level facilitates the MAPP framework and working with our community partners through that strategic planning process. We have a partnership called WCHIP, which is led by, it's facilitated by the Department of Health, but it's led by community members, part of our steering committee and organizations in our county that serve our county. And they kind of lead that community health assessment and community health improvement plan. And then we established something called Age Friendly Walton, which is an initiative to ensure that older adults are engaged with both the community health assessment and the community health improvement plan. Making sure that we have the right people at the table to discuss the needs of older adults that can reach that population and understand that population, their needs and their wants to live a healthy life. So we've kind of aligned the age-friendly kind of lens to a lot of our different plans, including our community health improvement plan, but we also have it included in our internal strategic plan, our emergency operations plan, making sure that that is kind of a lens that we look at to make sure that we're meeting the needs of all individuals in our community, especially those that are older adults, those with disabilities, those that could be vulnerable to natural disasters and man-made disasters and pandemics. So making sure that alignment is in place and strategic as well, to make sure that it makes sense, is very important. So that's always the biggest tip that I give everybody that asks me how do I incorporate age friendly into the chip. And I was like, you have to align as best you can, understand the needs of the community, but then incorporate it into your community health improvement plan. It's the perfect kind of center point, the community health improvement plan, for a lot of different initiatives, and age friendly is definitely one of those. Next slide. So as I mentioned, WCHIP, Walton Community Health Improvement Partnership. It's made up of about 50 organizations that serve Walton County, including our education system, our older adult population, individuals that are organizations that serve older adults, including our county governments, law enforcement. It includes a lot of different people, and we've really put a lot of energy and resources in doing and making this partnership happen. And it's definitely been a thing over the past 10 years. We established it in 2012, and it's just been growing and growing since then. And I know a couple of them are on here today. And we're really, like I said, the Department of Health can't really go out and solve all the issues. That's not our role. And our role is to kind of connect and convene, lead, and come up with some policy and solutions to a lot of the issues, identify the issues, and create synergy around solving those problems. And Department of Health, public health in general, doesn't have a lot of resources to go out and build housing or to put down pavement, better our roads, put new parks in. That's not, our role, but we definitely have a role to play in making that happen. And our partners are the ones that actually go out and do, and we're really grateful to have such great partners in our community. Next slide. So our initial alignment was within our 2019 community health assessment. Like I said, we did follow the original MAPP framework in order to make that happen. We made sure we incorporated surveys in older adult populations and working with partners like home health agencies, our Council on Aging, our Tri-County Transportation Center service. We incorporated a profile of aging as well. With Florida, we do have a great, a fantastic data source called Florida Health Charts. And I'll put that link in the chat for people that aren't in Florida, but we are really blessed to have a great system that we can look at primary and secondary data in. And there's an Aging in Florida profile that you can pull up and actually look at each county and certain indicators that you can look at, and specifically the aging population. That community health assessment then went into our 2020 to 2022 community health improvement plan. Next slide, I think. And within that initial CHIP, our 2020 to 2022 CHIP, we did have age-friendly activities built into some of the priorities. We worked with our senior centers with helping get individuals registered for the special needs registry. We participated in the point-in-time homeless count and resource fair. We established little food pantries. We did healthy walking gardens and putting in community gardens. Multi-generational parks has been a really a good initiative in identifying parks and giving local government and local parks and rec a foundation, a kind of a standard to build parks out of, and that's been a great partnership with definitely with policy. Art in the Park has been an initiative with connecting young individuals in school, some art classes, and connecting them with older adults with that are artists, and they do murals in parks, which has been a great collaboration with the Sheriff's Office and the Cultural Arts Alliance. We did a poverty simulation at a church. We had a healthy aging fair. We participated in the Housing and Health Action Learning cohort through the National Association of Counties. And then, of course, a lot of this during this time frame went into the COVID-19 pandemic response. Like I said, having that age-friendly lens really helped had a foundation and already had those connections in order to make sure that we are reaching out to the older adults and making sure that they're aware of where the testing sites are, where the vaccination sites are, establishing a home-based vaccine program with partners, and then all the other social and economic things that happened during the COVID-19 pandemic. That was one of the reasons that sparked the little food pantries, and we have about 12 of them throughout Walton County, thanks to United Way, because we saw that food insecurity was getting worse and people were out of jobs, and it definitely took a toll on a lot of individuals and families, and that just was exponentially more for older adults because they already live in sometimes a very unstable paycheck to paycheck, even though it's not a check to check kind of mind frame and lifestyle. So it's important for us to think through and have that mindset during the COVID-19 response. So next slide. Convening stakeholders, that's something, again, a very public health responsibility for us to do. And at the end of our last community health improvement plan, we go into another community health assessment cycle, and we establish a 2020 community health assessment. We convened stakeholders, and we were finally able to meet in person, and we're happy. We really transitioned really well to a virtual option. We were only meeting in person as a community health partnership. When COVID happened, we kind of took off a quarter, and then we established an online version to keep our momentum going. We were lucky to have partners that were able to transition to a virtual option. A lot of counties really had a strong kind of abrupt kind of stop point for their CHIP because of COVID-19. We continued through it, and that's mostly because of our partners meeting and wanting and CHIP becoming the center point to actually learn about what's going on in our community, what resources are out there, what new resources, which organization got funding to do emergency housing, and those kind of things. So that it's really important as a foundation. And like I said, our partners really, it's like a center point for our partners to talk. And that's the point of it. We had the Healthy Walton Summit in November 2022. We determined the priorities of the 2023-2025 CHIP, started coordinating existing supports and services and to help support with those priorities, and to determine what programs exist per priority area, and what are the potential evidence-based informed interventions for the priority areas. You can go to the next slide. So like I said, we continue to align the age-friendly kind of structure, and we kind of take pride in being a local public health system that is age-friendly within our community health assessment and also our community health improvement plan. So next slide. Our priorities for our current CHIP is the first one, mental well-being and substance use. Second one, access to care. Third one, maternal and child health. Fourth one, injury, safety, and violence. Fifth one is social and economic conditions impacting health. And then the sixth one is chronic diseases and conditions. I laid out the kind of not objectives, the strategies, something like that. I keep on all the words. So working on for older adults, reduce the impact of adult mental health, emotional behavioral health disorders. That is something that we're trying to do. Go to the next slide and it'll explain things a little better. So these are the things that we're actually doing per the priority area that is considered within the age-friendly framework for the mental well-being and substance use. Definitely with mental health and behavioral health, we really want to focus in on social connectivity and connectedness. So working with organizations that already are kind of working with convening older adults and making sure that there are activities in the community that older adults can take advantage of. For instance, Tai Chi classes are one of our partners with West Florida AHEC. West Florida AHEC does Tai Chi classes, and they just expanded them to the senior center to offer them there. So that's something that we kind of help support and try to get people linked to, and they have a waiting list. So that's definitely something that's stable, and our older adults love it. And then we have the Retired Senior Volunteer Program through United Way, or the RSVP program. That is something that our senior centers help support as well with United Way. Trying to get older adults and our seniors involved with. There's so many opportunities for them to be utilizing their resources, which are their things they know. They've worked a whole career, and there's so much that they can give back to, and they just need the opportunity in the right place to thrive. So that's something that we work with United Way in order to get these individuals involved in volunteering and back into into the workplace in a way. That's something that's really been going well. With access to care, we have a partnership with the University of Florida to establish a family practice residency program here within one of our branches in the Department of Health, in our coastal branch, where there's a large older adult population. And we've done a lot of outreach to seniors to help kind of start that program. The first cohort of physicians that are training will be July of 2024. So there's a group there now that's kind of getting patients involved and trying to get them up and running. So that's been a great partnership. With the injury, safety, and violence, we are utilizing the CARFIT program through AARP. And we have a trainer that is on the call, Kay Brady, that is working with senior centers to make sure that seniors feel comfortable behind the wheel whenever they're driving. It's one of those things that, we think about young kids, students, they need to know how to do their mirrors and all of that. The way that you position yourself as an older adult in a vehicle changes, and it changes throughout your lifetime. So making sure that they feel comfortable behind the wheel whenever they drive. We're continuing things like Art in the Park and multi-generational parks, working with the senior centers with special needs registry, little food pantries, community gardens. And we also have an initiative called Read for Health. We're going to expand into the older adult population that focuses on literacy, specifically health literacy for older adults, and making sure that they know, what to talk to the doctor about, making sure they feel empowered to ask questions and all of that. With chronic diseases and conditions, we're focusing on cancer screenings. And also we're working with the American Heart Association for getting some CPR kits out in the community, as well as AEDs. They received a grant from a local funder to provide 25 AEDs in communities. So we're helping them kind of establish that with nonprofits and parks and government buildings, places that older adults will be, to make sure that they have life-saving materials around that could help. One of our hospitals in our county, like I said, we're a small county, but we had 2 hospitals. One of them closed in the north end of our county. Hopefully it will reopen soon, but it's been about 2.5 years that it's been closed. And we've definitely seen a increase of barriers for people to get health care, definitely emergency health care. So that's something that we're focusing in on, specifically with heart health. Next slide. And that's me. If you have any questions or anything you want to ask, feel free to email me or call me. I'm with the Florida Department of Health in Walton County, and I'm always excited and happy to talk about some of the things we're doing and sharing. I'm all about not creating, recreating the wheel and borrowing and adapting to where you are and people you serve. That's really important. So yeah, that's it.
Thank you, Ryan. We really appreciate your leadership and all that you're doing to improve the whole community across the life course in Walton County, and kind of being an inspiration to a lot of other places in Florida. So Karan, you can go ahead and take the slides down for now. So there was one question, Ryan, that came in for you. Do you have more information on the Read for Health or a link to the efforts? You could provide a little bit more information on that.
We do not have a link, unfortunately. The main focus initially was with kids, and we've had a lot of success working with Head Starts and even within our offices with connecting kids with literacy kits for at-home reading. We haven't really started publicizing our older adult expansion yet. That's within the chip, so I can definitely share a little bit more, Karen, if you email me or call me.
There you go. Thank you. So we will open up to questions. Okay, another one just came in on the chat from Yen. Can you share a bit more about more information about the intergenerational parks?
Absolutely. So in 2020, might be 2021. It all blurs together now during COVID.
Yeah.
We conducted a parks assessment thanks to an intern out of the Region 4 Public Health Training Center. And they came down and went to all of our local parks and did an assessment, a photo voice with some of our partners. And out of that, some recommendations came, and one of those is we utilize, again, borrowing from other counties. Monroe County in the state of Florida had a multi-generational assessment, kind of an evaluation form, whether or not they met the basic criteria of making sure, the bathrooms are ADA compliant, the sidewalks are decent, there's signage in different places, there's resting stations, there's hydration stations, all of these different kind of factors that go into it. And we utilized a kind of an evaluation form. And then we looked at the parks assessment and saw that 3 of the parks actually met all the qualifications. And we provided all this to our local county and city officials And they kind of adopted it as their the evaluation of age-friendly parks and multi-generational parks as their standard. They really saw that. I was like, okay, there are some parks that really need some help, whether that be broken sidewalks or sidewalks not completely wide enough for a wheelchair or a wheelchair and a person beside them, making sure that there are resting stations. And through some of our funding, we actually purchased some benches for the parks to install. So we really have been utilizing that in our city and county. You know, we have a good relationship with them. It wasn't like a critical kind of look at these parks. We just wanted to make sure that they and it wasn't like it was a very asset based. So we talked about the good things too. And we were really proud of our environment in Walton County. We have a lot of beautiful parks, state parks. We are the highest point in the state of Florida. There's a park there of like 300 and something feet high. But yeah, there is a website, and I'll put it in the chat of some of our multi-generational parks.
That'd be helpful. And if you have, if that evaluation is something that you could share with us as well, we can send that out too. That would be really helpful.
Website as well.
Thank you. So there was a question, I think, Anna and Abby, this might be a question for you. Considering the goal of age-friendly and MAPPS 2.0 is intersectional inclusiveness, how can we break down age-related barriers to healthy adult development and aging? If we continue to classify adults as older by some age criteria or cutoff like 65, we perpetuate exclusionary data and data-driven efforts to promote healthy aging. So kind of a comment, kind of a question. I don't know if you might have a response to that.
That is a thought-provoking question, and I appreciate that. I would be interested, and I'm punting it over to Ryan. I'd be interested in Ryan's perspective on this as more of a healthy aging specific expert here, but happy to then add anything about MAPP after.
1 second.
Yeah, Ryan, is that, I wonder if that's something that you all have thought about, is like, what is that, you know, is there an age cutoff for people, you know, it's like 65 and older? Because some people who are 65 are not in the same health status or health ranking as, you know, someone who's older or younger. So
yeah, it's one of those things you have to be, you have to look at it, the data multiple ways, I think. Like, we look at even 50 and older because we're thinking of the next individuals that go into the older adult, our middle adults going into older adults. Our older adult population, what we consider older adult, is growing exponentially in general. But you're right, there are a lot of factors that go into it. It's not just their age, it's their health status, it's their individual characteristics that that you have to understand as well. We have individuals in our county that definitely the new individuals that coming in that can afford to actually come into our county. They're gonna that increases our life expectancy, and because they are individuals that can afford to come down in our county. It's expensive to live in Walton County, definitely in the center part and the south part of our county, and that's where the majority of individuals are growing. It's not cut and dry yet. Like it's a for sure kind of thing. We have to look at pockets of older adults and as narrow as possible. I look at, you know, census data and understanding the life expectancy of each census kind of group, census tract, because we have one census tract that'll have a life expectancy of almost 90, and we have one that is upper 60s. Like we have a huge disparity of a life expectancy based on census tract. So interventions and not being, you know, grouping all the older adults together in our county into one is very important. It's not cut and dry. Yeah.
Okay, thank you. We are actually at the end of our time. So Anna, you're off the hook there, I think, from responding to that one. But just want to say thank you so much to our partners at NACCHO and Walton County Florida, thank you all for attending today. This has been really helpful, very interesting, and I hope has given you a lot of ideas for your jurisdiction or for your age-friendly work. Please feel free to send us any additional questions you may have, and we can share them with our speakers. Karan, you want to pull that the slides back up? I know you have a final message for our couple final messages for our audience today.
Thank you, Megan, and thank you again, Anna and Ryan. I really appreciated all the information you shared. To wrap this up, we have exciting news. Early next week, stay tuned to your Apple, Spotify, or wherever you get your podcasts. We're going to be launching the AFPHS podcast. We're excited about this production, and our first speaker is the Dr. Terry Fulmer, president of the John A. Hartford Foundation. So we're very excited about that. And our host for our podcast series is our own CEO at TFAH, Dr. Nadine Gracia. So stay tuned. It'll send out emails as well. So if you follow us and if you're on our newsletter distribution, you'll get a link to it. So we're very excited that we'll be announcing that next week. And then coming up next month, our training will focus on our rural health brief. I shared a link to that in the chat earlier. So if you would like to get more information from the actual one, the main author of our brief, and to talk more about the recommendations, stay tuned for our September registration links. It'll be on our website under the events link. So keep on the lookout for that as well. And then if you are attending and viewing this training after we have done the live session, which means not currently, please pause the training now to indicate that you have attended it by navigating to the URL code listed or by scanning the QR code right here. So you can pause it and come back. But if you're here live, you don't need to do this. And we thank you all for attending today.